Good afternoon. We are live. This is the Human Services meeting for October 6th, and my name is Judy Hopkins, Chair of the committee. Our first order of business today is a roll call.
Mrs. Hopkins.
Here.
Mrs. Burdick.
Here.
Mr. Barnes.
Present.
Mr. Decker.
Here.
Mr. Havey.
Here.
Mrs. Root.
Here.
Mr. Stockin.
Here.
Mr. Crandall.
Here.
8 members present.
Thank you very much, Sarah. Okay, then next order of business is to approve the minutes of September 1st, 2021. Do I have a motion on that? Mr. Stockin, second by Mr. Decker. Any discussion on that or changes? All those in favor, please say aye.
Aye.
Any opposed? That is passed. The next minutes that need to be approved are September 27th, 2021. I need a motion on that.
I'll make that motion.
Mrs. Root, second. Mrs. Burdick. Okay, thank you. Any discussion, changes? All those in favor, please say aye.
Aye.
Any opposed? That is passed. Thank you. Okay, we do have a substantial agenda today. We're happy that our department chairs can be a part of it. First guest is Dr. Robert Anderson from Mental Health Services, Community Services Director. Thank you for being with us today, Dr. Anderson. We understand you have a budget adjustment.
Thank you. This is on.
You have to. Okay.
I should leave it off, I think.
No, we need it on.
Did any of you, I know we've got a busy agenda, but I have to ask one question. Did
That's
any
okay.
of you watch the public meeting, the first public meeting of the Commission on Medicaid, Marijuana Management? Did you watch that?
Do you have some comments to share?
No, it's
We'd
in
be happy
public.
to hear from it.
If you get a chance, you want to watch it. It's only a half hour, and it's interesting to see the makeup of the board and what they are supposed to do. It's also they have 6 months to accomplish what they should have done in the last 9 months, and it's really very interesting how they're going about it. Anyway.
A question for Mr. Healy on that, I think.
I hate to go on record about anything.
Well, that was going to be my question.
Take that as a yes.
Was there anything positive you could say about it?
Yes, they got people who are enthusiastic about doing their job. They have people who are committed, not should be committed. I said they are committed to doing what they need to do to get the law to work. Now, if you were asking me, am I in favor of the law? I'm ambivalent. But anyway,
Thank you.
the budget transfer or adjustments, there are, I believe, 6 of them. I would like to do them all at once, if that's okay with the rest of you.
I think, Dr. Anderson, I think we have only one on, there's an MOE. There are a number of accounts. There are 5 accounts that are expenses and 6 accounts that are revenue adjustments. And for me, the most important thing is I spoke to our treasurer, Ms. Ross, and she's the one that wrote the MOE, so I know it's all done correctly.
Yes, we can, I believe, deal with the total amount, and
Yes, I think you can skip right over all the individual
The
accounts
numbers.
and go right to the total amount of 131,919.
okay, so
That's
let's,
great.
okay. So what we're looking for is a motion for a budget transfer of $131,919 within the community services budget. And various accounts are affected, but it all balances. That's important. So we're looking for that motion. Mrs. Burdick, second by Mr. Havy. Okay, any questions about it? You all have it in front of you, I believe. Okay, if there are no questions, we'll take a vote. All those in favor, please say aye.
Aye.
Any opposed? It is passed. Thank you.
Thank you very much.
Certainly. Thank you for coming. Our next department we're going to hear from is Public Health. Jamie Darcy, the Deputy Director, is going to be with us today to share information. We'll get that plugged in. Push the button. Make sure you see a red light.
Okay,
You're in business. Thank you, Jamie.
thank you.
We're all good. Thanks.
So I'll start with the monthly report, some of the key highlights there. We have filled the environmental health director position after almost 10 months, so that Mr. Charles White will be starting on October 18th. Rabies Clinics, we had one at Belfast and one upcoming at Genesee Valley on 10/16, and our current year-to-date vaccine numbers for that is 628. Flu clinics, we've held 2 in September and 6 total in October, giving us 178 flu vaccines given to the community. As far as COVID goes, numbers, as I'm sure you're all aware, have not been great. We have currently 102 positive cases and 360 in quarantine. Our positivity rate is 10.25%, which is up about 2.7% from last week. Breakthrough cases, 104. And if you take that as a percentage of the total amount of people vaccinated in the county, that comes to about 0.6%. So really not too bad for breakthrough cases. And our total percent of vaccination for the county is 37.4%. So creeping up there little by little. We do have 19 people that have qualified and have gotten the additional dose, and the booster dose for Pfizer has been approved. So starting on October 19th, we'll hold our first booster dose for Pfizer here at the county building. We also have a J&J scheduled for the RAM clinic this Saturday at Genesee Valley, a Moderna on 10/15, and another Moderna on 10/27. We are going to try to focus mostly on the Pfizer and J&J because Moderna and J&J's booster doses or additional doses have not been approved at this time. We're also looking at starting back up on rapid testing 2 times a week. The demand is so high that the labs are being inundated with testing, and we're starting to see where we're not getting results back for 4 or 5 days now. So we've talked about that, whether we have the resources, and I believe we're just looking at trying to find a place that we can hunker down twice a week and do some community testing. The ELC school grant is pretty much finished, so excited about that. Everything was finally approved and completed on that yesterday. Quadrant will be sending us supplies. We should be receiving them tomorrow or Friday, and hopefully we can get those COVID testing supplies out to the school so they can start testing their students and faculty staff. And generally, that lab is in Buffalo. We should have results turned around in 12 to 24 hours, so much quicker than going through the hospital at this time. Any questions on COVID updates?
Yes, we have a couple questions. Mr. Healy was first, and then Mrs. Root.
Thank you, Madam Chairperson. Did you say you're going to have the 3rd dose of the Moderna vaccine available or not?
Moderna, no. That has not been approved yet. Pfizer will be starting on 10/19. That's the only one that's been approved.
Okay, so those other clinics are for the 1st and 2nd dose? or-
First, second dose, yep.
Thank you.
Okay, Mrs. Root?
All right, thank you. What is the rate of false positive with the rapid testing, do you know?
For Bionex, which we call a rapid test, but that's an antigen, it's about 60% accurate. So with the rapid molecular, the Abbott machines that we use, that's about 90%, and then the PCR is closer to 98%. So the PCR is the best test to get. That's why a lot of the schools right now, they only have Bionex cards, so they're seeing a lot of false negatives and false positives. So these quadrant tests that we'll be getting them is an oral PCR, so it's pretty much the best that they can get. So that's going to help make sure we're getting accurate testing done at the schools.
And I just have a question. I think that the accuracy rates are also dependent on whether you're testing an asymptomatic population or a symptomatic population, that a lot of these tests are really designed for a symptomatic population but are being used in an asymptomatic population, which lowers those rates down to like 60%.
Yes, particularly with the Bionex, that is a much better test for symptomatic versus asymptomatic.
So if you were using it, if you had like a nursing home or a hospital that had an outbreak where everybody was experiencing COVID symptoms, I think you'd see a much higher accuracy rate, correct?
Yes, yes.
So go back to that. Our schools are using that, and typically your younger people don't have a lot of symptoms or aren't have the COVID. So are the schools seeing a lot of false positive and putting them into a tailspin when unnecessarily?
We're hearing of some cases that are coming through by using the Bionex, and then they go and get tested and wait for their PCRs to come back, and they end up coming back positive, and the Bionex showed negative. Some schools are choosing not to allow Bionex testing. They have the option to use the free government testing, which is Affinity. So some of them are using that. Some of them have their own CLIA license, so they're doing their own testing with the Abbott machines that we use. And I know Dr. Casas is not accepting Bionex as a release for any of his patients.
Okay, thank you.
Thank you. Thank you. Any other questions for Jamie pertaining to this part of her report? Mr. Barnes?
Yes, this goes to lead, first thing on your sheet here. And when it says cases managed, what are you actually doing there? Just following up on people who've tested positive for lead?
So this is the nursing part of it, the clinical part of it. When there's a lead case, they have to follow them until they are under the 5 blood lead level. So until that child goes under the 5, they have to follow them. And that could be years, depending on what their level started at. On the environmental side, that number could be different because we're following where the lead is coming from in the house and making sure that that is abated. So sometimes that could take years for that child, if they were at 30 for their blood lead level, to get back down below 5.
And how is there medications that help cases eliminate the lead, or how does that work?
The nurse in the clinic would refer them back to their pediatrician. They, depending on their level, sometimes they have to go have their venous blood drawn every 3 months. If it's over 15, then they have to go monthly. But then they sit down and go through nutrition is the biggest one. Obviously, abatement in the house, if that's where the lead is coming from, is huge. The quicker they get that done, obviously the child's level should be dropping. But nutrition is a big, huge one of them, vitamins, and there are some injections for the kids that are over, I think, 30 that they can get done. We're seeing a struggle this year with that, and we've had to, with the abatement of the homes, some people are struggling monetarily, and I know a court has stepped in and helped with buying them paint so that they can do the work themselves and paint over the paint that is chipping or falling off. That's usually the source of the lead in the homes.
Is the vast majority of the lead coming from lead paint? I mean, is there
Yes.
other sources?
We do soil testing on the drip line of the house, around the house, and we also do water testing to make sure that the water coming in from the main line is not a lead line.
pipe or-
Yeah, and in most cases, I would estimate, I have not seen a positive water or a positive soil, so I would say the majority of the cases are from the paint inside the house or outside of the house.
Thank you.
Thank you.
Okay, any other questions or anything else you'd like to add on your monthly report, Jamie?
The only other thing I think that I have is that Dr. Duppner, as some of you know, will be retiring at the end of this year, and I spoke to him last week, and he will not be continuing on as our director. So we do have to find a new director for the Department of Health, and that means a lot of standing orders and agreements and stuff will have to be re-signed by the new director that we find. And I believe Tyler is trying to find somebody to fit that role.
And say again when he plans to retire?
December 31st, the end of the year.
December 31st.
Yeah.
Okay. Okay. So that could be a challenge.
Yes.
Okay. Okay. Okay, I think we can move ahead then to your request to fill for the medical computer operator, medical records computer operator.
Okay. So this is due to a resignation, excuse me. It is 70% funded salary-wise through the state and 30% by the county, with 100% of the benefits being, being funded by the county.
Okay. We'll need a motion on that. Mrs. Root, second, Mr. Havey. Okay, any questions about this position? It is an existing position. The appropriate people have signed off on it in terms of having seen the application or the MOE. Okay, all those in favor, please say aye. Aye. Any opposed? That motion is passed. Thank you. Okay, next.
This is for an office aide position in the COVID part of the department. This is due to an internal movement. One of our current office aides is moving into the temporary nurse position, opening up that position. It is 100% funded by the federal government grant, and because it's considered part-time, there are no benefits.
Okay, we need a motion, Mr. Stockin. Thank you. Second, Mr. Havey. Any questions about that? Again, these are this is coming from the position, it has to do with the contact tracing and all the things related to COVID. So, okay, if there are no questions, we'll take a vote on that. All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you, Jamie. Next, we have a request to fill for a registered nurse.
Yes, this is a full-time position. This is due to a resignation. The annual salary is $54,576. It is 100% state funded, with 100% of the funding for benefits by the county.
Okay, and again, this is to include the reproductive and sexual health programs, the STI testing and treatment, immunizations, and communicable diseases. So we'll need a motion on that. Mrs. Burdick, second by Mr. Havey. Okay, any questions about this position? Okay, yes, Mrs. Root.
How many registered nurses do we have in the department?
At this point, one, our DPS resigned and this nurse resigned, so we have one
Left.
nurse working for us right now.
So typically, though, we would have 3.
Yes, because the DPS is a registered nurse, yeah.
Okay, thank you.
Okay, and there's so many functions that we absolutely need RNs for.
Yeah.
Yeah, okay. Any other questions? Okay, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you very much. And next, we have a request to transfer funds.
Yep, this
Within-
is for the WIC department. They have monies left over in their regular pay from 4010-101. They would like to transfer those into various other divisions of 4190, including 201, 406, 407, and 408, in the amount of $10,143.
Okay, thank you. Well said. Motion by Mrs. Root, second by Mr. Stockin. Any questions about that? All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. And next, we have a request to accept and appropriate Allegheny County Area Foundation grant funds.
Yes, the health department was awarded $1,000, and originally it was put into 2025 1689, which is other health department income, and we would like to transfer that to 2025 408, which is general supplies.
Okay, I'll take a motion on that.
I
Oh,
do
yes.
have a remark. I've been trading some emails back and forth with our treasurer, who's not able to be here today, and she really thought it should not be going into general supplies, but there's a separate line item for gifts and donations, which is A 2025.2705.00, and she was requesting that we amend this MOE to put that in instead.
Okay. Is that agreeable to you, Jane?
Can you repeat that again, Chris?
Yeah,
So then-
we'll get the number again.
Yes, it's A 2025 .2705.00, gifts and donations.
Okay.
Okay. And then are there requirements on the use of that money in that category?
I'm not sure at this moment, but that is where the treasurer thought it would be most appropriate to put it.
Well, it's certainly the appropriate title for it. Okay.
Madam
Mrs.
Chair,
Ruth?
do you need a motion to make that change?
Yes, to
I'll
amend
make
that.
that motion to amend.
Thank you, Mrs. Root. Second by Mr. Decker. Okay, we'll vote on the
Amendment.
motion as a whole. No, the amendment.
Amendment.
I'm sorry, there's. Madam County Administrator, we vote on the amendment?
Yes.
Okay. For some reason, it's blanking on me. Okay, we're voting on the amendment then to transfer it to that different category. I won't repeat the number again, but we all have it down that need it, and that's in the gifts category. All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Okay, now we'll vote on the entire budget transfer of $1,000. And it will go to that new category with the long number. And I'll take a vote, we'll take a vote on that. Mr. Decker? Oh, wait, we have a motion on that already.
Yes.
Yeah, we just need to have a discussion. If you have a question, Mr. Decker? Okay, so we're going to vote on the original amended resolution. Okay. All those in favor, please say aye.
Aye.
Any opposed? That is passed. Thank you. Okay, we'll try not to make it too complicated this time. Sorry, I messed that up. Okay. Jamie, your next is the approval of an agreement, I believe, with U of R Jones Memorial Hospital for post-exposure rabies treatment.
Correct, ma'am. This is an annual agreement that we have with Jones Memorial Hospital that we pay no more than $1,000 for post-exposure rabies treatment, no matter what the bill is. And that came due, so we're just looking for approval on that
Okay.
agreement.
Motion by Mrs. Root, second by Mr. Stockin. Okay, any discussion on that? All those in favor, please say aye.
Aye.
Any opposed? That is passed. Thank you. The next one is a similar agreement with U of R St. James Hospital for the same post-exposure rabies treatment. Take a motion on that, please. Mr. Decker, second by Mrs. Burdick. Any discussion on that? All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Okay, and the next one, go ahead, Jamie, we'll let you share that with us, the ratification.
Yep, we're looking for approval for the ratification of the Public Health Director's signature, Tyler Shaw, for Quadrant Biosciences. This is the company that will be purchasing the oral PC swab kits for the schools to do their testing with.
Okay, need a motion on that? Mr. Havey, second by Mr. Stockin. Okay, any discussion? All those in favor, please say aye. Any opposed? That motion is passed. Thank you, Jamie. And one more, approval of an MOU for you.
Yes, this is the approval of an MOU with Appalachia Substance Use Disorder and Mental Health Services Coalition that the Director of Health will serve on this committee and serve as a resource for this coalition.
Okay, need a motion to start that? Mrs. Burdick, second by Mr. Havy. Any questions? I have a question. Jamie, can you just tell us a little bit more about this particular coalition? Is it something local? Is it regional or what?
The coalition spans, I'm sorry, let me just
That's okay, take your
open up my
time.
notes. The coalition spans the southern tier, which includes Cattaraugus County and Allegheny County. Each committee member is from different avenues of either public health or business in order to get a good mixture of committee members. The coalition itself, their purpose and scope is on page 2 of that agreement, but basically trying to focus on substance use disorders, drug usage in schools, and opioid disorders.
Okay, thank you. Do we have anybody else on the coalition? Either?
No, Tyler
Tyler's
was the only one to
one.
ask to be on that, and I'm assuming I'd fill in if he wasn't able to.
Okay, good, thank you. Okay, any other questions? Okay, we'll take, yes, Mr. Decker.
Your explanation, you said Allegheny and Cattaraugus County. And the MO for MOE, I don't see Cattaraugus County. Should that be? Just one of the opponents, both counties?
It's a joint coalition, so if you see Cattaraugus County Public Health, Olean, New York is one of the partners, Cattaraugus County Community Services, Southern Tier Healthcare System in Olean. Those are on page 2 under partners.
Yeah, I don't know as we have page 2,
Oh, I'm
Jamie.
sorry, maybe you
Not in the
don't.
not in the
Okay.
written copies
Okay,
anyway.
I'm sorry, I didn't know that you guys didn't
That's
get a
okay.
copy of that. So, yeah, it's, the partners are CARES, Council of Addiction and Recovery Services in Olean, New York, Allegheny Council on Alcohol and Substance Abuse, ACASA, in Wellsville, Southern Tier Healthcare Systems in Olean, New York, Allegheny County Community Services in Wellsville, Allegheny County Public Health, Belmont, Cattaraugus County Community Services, Olean, Cattaraugus County Public Health, Olean, New York, and Clarity Wellsville Community, Inc. in Wellsville. Sorry.
Thank you, thank you. Let's hope they can do some. I have one more question, actually. Is Allegheny County required for any monetary contribution to this coalition?
No, I believe that Tyler had a conversation, I believe, with Carissa, that it's basically his time and his education and knowledge that of sharing with these groups.
Okay, great, great. Thank you. Okay, we're ready to vote on that, I think. All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you, and Tyler will certainly be a good representative on that coalition. Thank you. Okay, and do you have anything else you want to share with us today?
No, ma'am.
No?
Nope.
Okay. Well, thank you very much for stepping in, and you did a fine job.
Thank you.
Thank you. Okay. Okay, our next report would be from Anita Madison. Anita's not here today. Kim, right? Kim Jeffers will be in, and Kim is the accountant. And she's looking for a card. No, it doesn't really. Just, you're good. Thank you. Okay, great. We're here. We're ready to hear about Office of the Aging then.
All right, so Anita is away at a training in Rochester today. Excuse me. So she asked me to step in so I could highlight on our monthly report. The first thing is our health insurance counseling is up from last month, but also up from last year, and we are moving into the Medicare open enrollment season, so we expect that will continue to rise as we go through. Our home delivered meals are also back up. They were down a little bit last month, but we're even now still above what we were at this month last year. So we are continuing to serve meals to the seniors in Allegheny County.
Okay, that's certainly, you will be busy with that health insurance counseling. It is an excellent service that Allegheny County does for our residents in terms of being able to help them analyze the programs that are out there and in an objective way. So thank you all very much for doing that. We know you're going to have a lot of
I have a lot of respect for our health insurance counselors.
Okay. Thank you for sharing that. Any questions on the monthly report? Okay. Can we have one on acceptance of a donation from the Allegheny County Senior Foundation?
I just want to make another comment. The treasurer also thinks that the revenue account on this one should really be the gifts and donation account rather than the CHGS for OFA, and would request that we change that to A6778.2705.00.
Do the point part again.
0.2705.00.
0.00, okay. Did you all get that? Okay, thank you.
Madam Chair, I make a motion to accept that amendment.
Okay, second by Mrs. Root. Okay, thank you. And that, I assume, Kim, is agreeable with your,
I didn't realize
Office.
we had that account under this grant specifically, so
Okay.
yes, I absolutely
Okay.
agree.
we appreciate our treasurers watching
she's
over the
constantly
meeting
saving us.
and keeping track of this. So, Terry, we wish you well. Thank you. Okay, I think we're ready to vote on that. All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you very much. Kim, anything else you'd like to share with us today?
I don't believe so.
Okay.
Thank you very
well-
much for having me.
Well, we thank you for stepping in. Appreciate it. Nice job. Okay, and our next report will come from Edna Kays, our Social Services Commissioner, and she is approaching the mic.
Good afternoon.
Thank you for coming, Edna.
Thank you. I don't, if you have any questions about the report, please absolutely share, but I did want to share with you that currently there are in the county 151 ERAP applications for the back rental. I think I've told you about that before. I cannot tell you how many of those have been paid out. They don't share that number with me. They just share that the county's funded. I can see the contract numbers, and they just simply share that the contract is funded, or the money's funded in this county. So I can't see how many of those have been paid out, although I know it's been very slow. But there's also the American Rescue Plan has also added the regular arrears supplement plan. If you haven't heard of that, that one is anybody that is back, that is eligible for temporary assistance, HEAP or SNAP, and they have back bills on their gas and electric. This will pay for up to $10,000 in arrears per family. So, and those lists were received from the utility companies and sent to us. They don't have to be applications that are filled out by folks that are behind on their utility bills. They've sent to us, and we have to fill out a form. And at this point in time, we've been sent 268 names to start. So we've started working on that, filling those out so that those people can, their utilities that are in arrears can be paid. Directly to the utility company, yes. Goes directly to the utility companies. So that's my news on that. Any questions?
Okay. Thank you. That's going to be a big project, I'm sure. So thank you
Yes.
thank your staff for taking that on.
Yep, they've started working away on that. And that's just the first list.
Okay.
Okay.
If there are no questions, we'll move along to the action items. The first is the acceptance and appropriation of additional federal aid captive funds. You can share that with us.
Yep. The Captaincare Funds, that's funding that we've been receiving for a few years now. It's always $50,000 every year. That funding is utilized, we use that for a contract with a CASA to staff our comprehensive and addiction recovery issues. So that would be applied to parents who have at birth have a baby that is either has tested positive for some kind of drug, or for a parent while at birth has tested positive for drugs. And then we partner with that parent to make a safe plan for that child and for that parent to work toward a sobriety treatment so that they can care for their child. And that's what that money does.
Okay.
And that's $50,000. I think we get that. We've gotten that for a few years now.
Okay. Motion by Mrs. Root, second by Mr. Stockin. Thank you. Any questions about that? I have one, and just you mentioned when the babies are tested. Are all the babies tested automatically at birth, or
No, there has to be suspicion. So,
suspicion?
yeah.
Okay. Thank you. Okay. I think we're
Madam
ready.
Chair?
Yes, Mr. Decker. Thank you.
And do you use up all those funds every year?
Yes, we do.
Okay, I think we're ready to vote then. All those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. Okay, Edna, we have a number of resolutions here. We will be able to do a number of them all together. Yeah. Starting with the one for new directions for youth and family services, and going all the way down to the foster care contract with Gateway Longview Incorporated. Those can all be treated with one resolution. So once we have a motion on that, I will ask you to just explain a little bit about those. I know they are recurring contracts and so on. So we'll take a motion on that. Mrs. Burdick, and second by, I saw a hand, Mr. Decker. Thank you. Okay, and the motion will be to accept these resolutions as stated in the list of resolutions in our agenda. Okay, so why don't you just share a little bit about these in general?
So for the past couple of years, we have been working on the Families First legislation. So Families First came about basically because of 4E funding. 4E funding is federal funding to cover care for children that are in foster care, particularly in congregate level care, residential placements. That money, the federal government said to the state government, you need to do better with that. So the Families First legislation came out. We've been working on that for 2 years. We've worked hard with probation and at the table and worked on building a plan around the regulations that took effect on September 29th. The regulations require that any congregate care level placements, any congregate care level agencies now have to be qualified to provide residential treatment. And to provide that residential treatment, they have to provide 24-hour medical care as well as 24-hour mental health care. They also have to provide aftercare where they work with the families once the child returns to home. Most of these cases, the majority of these cases, are juvenile delinquent cases. Not RTA cases, but mostly juvenile delinquent cases. These once a child is placed in a qualified residential treatment facility, a qualified individual is assigned, somebody who is qualified, qualified individual who's qualified to do an assessment on children to decide whether or not that placement by family court is appropriate, is an appropriate placement for that child. It has to be done in a time limit of no longer than 30 days, and it has to be turned around within the court system within 60 days. So you'll see contracts here for these foster care contracts for various agencies that may have qualified residential treatment plans for their agency. And so the state did give us an amended contract to provide, to join in contract with all of these residential placements. Sorry, I'm getting all, it's that big thing over there. But anyway, so so we've been working hard to get those agreements with the agencies. We've been having one-on-one conversations with them, trying to see what they're doing for their legislation, how they're changing their treatment, what it's going to look like for when children return home, what we can do to help. These are amendments to the existing foster care contracts. OCFS said that we could do an amendment to our existing foster care contracts. I think we generally do those in June. So these are the amendments that go to the existing foster care contract that cover Families First legislation. You'll also see two contracts with QIs. There's a contract for Melissa Ball and a contract with Hillside Children's Center.
We're going to do those separately.
Okay,
and
I'm
then-
sorry.
No, it's just the 12.
Then I'm good with the 12 at this point, if you guys
Okay.
want.
Okay, good. Question, Mrs. Root?
Yeah, I have a really quick question.
Okay.
You said RTA. What is an RTA?
RTA is, those are the children that are over 16 years old that commit crimes, that the children that we had to bring out of the prisons and had to find RTA placement with them. They're reimbursed in a whole different way, so they're not really a part of this.
I just didn't know what an RTA was.
Yeah.
I believe it's raise the age, right?
Raise the age, oh, sorry, yes, raise the
Yeah.
age, sorry.
Okay. Okay. Any other questions? Yes, Mr. Decker.
And there's an awful lot of them on there. I guess there's 12. And one of these is in Rochester, another one in Buffalo. Are the children that are being cared for all Allegheny County children? And why would we use an out-of-area agency like Rochester or Buffalo?
So actually, some of these are in Binghamton, Bath, Buffalo, Jamestown, they're all over, except for there are no residential treatment facilities in Allegheny County. So we have to rely on facilities that are outside of our county. So we make sure that we have contracts with as many of them as we can because we share them with the rest of the state. And so it's very difficult sometimes to get beds. So we try to flood it so we'll be able to find a bed.
And
on
so
the
basically,
average-
these are just-in-case situations, Mr. Decker,
Yes.
where we don't use it until we need it.
And do
We need to have the contract in
they
place in
funded?
order to do it.
Yes.
It's all funded so that
Yes.
and where does the money come from
So.
the state?
Yes, it comes through reimbursement, but we include these in our budget every year. They're already budgeted. In fact, we've been planning for Families First. So anything that I'm talking to you about today, we have included in this year's budget, as well as next year's budget. But we've had these contracts with these agencies for years, and they've always been included in the budgets. They're based on all of these are based on a MSAR, so there's a maximum state aid rate that we can pay each of these facilities. It varies per facility, but on average, it's about $181 per day per child, on average. Some are higher, some are lower. But we budget for this every year.
Let me see if I can simplify to, as we're kind of processing this. We already have contracts with all of these agents.
Yes.
What we're doing is amending the contract, the existing contract, to include the Families First, I can't even say it, Families
Legislation.
First legislation language regarding the requirements for foster care children entering qualified residential treatment programs. So
Yes.
a lot of initials there, a lot of acronyms that we've been using, but we're basically amending an existing contract. Does that help?
That's perfect.
Okay. Any other questions? Mrs., yeah.
How did they get transported to these facilities?
Sometimes we transport, sometimes families transport, sometimes the agency helps us transport. It depends.
Thank you, Jan. Okay. Okay, I think we're ready to vote. All those in favor, please say aye.
Aye.
Thank you, Mr. Barnes. Any opposed? That motion is passed. Thank you. Okay, we have two more contracts to look at here. The first one is a contract with Melissa Ball, DBA MW Mental Counseling Services. Let's deal with that one.
So these contracts are for the qualified individual. These are our first two. We're also hoping to flood the area as we do with the residential placements. One of the parts of the assessment that they do, the pieces of the assessment, some of that can be reimbursed through Medicaid, can be covered by Medicaid, not reimbursed, but covered by Medicaid, and some of it cannot. Melissa Ball does not take Medicaid, but she is local, and if we really cannot find somebody to cover, then we would certainly ask her if she would be able to do that assessment. We would, as she cannot bill Medicaid, then we would look to pay for that out of our administrative fees. However, if we also had a child that didn't have any insurance, we could use her as well in that assessment. We also are asking to enter into a contract with Hillside for a qualified individual to do those assessments. They do bill Medicaid, so we would try to probably use them first, or any other agency that we come across that does have qualified individuals that will do those assessments. And we have been meeting with various agencies to try to work out who does have those qualified individuals and who doesn't, but at this point in time, we have two ready to move forward into contract.
Okay, thank you. So again, this is when we need it type of a situation. So I'm not sure we have the motion on this yet. No, we don't. Okay, we need a motion for to continue. Yes, Jan, thank you. Steve, second, thank you. Okay, any questions for Edna? If not, all those in favor, please say aye.
Aye.
Any opposed? That motion is passed. Thank you. And the last one is as Edna mentioned, the contract with Hillside. And is the only difference that they will take Medicaid as opposed to being part of this arrangement. Okay, so we'll have the motion on that, Mr. Stockin, second by Mrs. Root. Now, any questions? Okay, all those in favor, please say aye.
Aye.
Any opposed? That is passed. Thank you. And anything else you want to share with us today?
No, I got through it.
Okay, thank you. Good job. Good job.
Thanks.
It's a lot of information, a lot of information.
Have a good day.
Thank you. Is there any old business today for the committee? Any new business? Anything for the good of the order? Mr. Decker?
As there appears there's no more information to come before the committee, I move that we adjourn.
Thank you. Is there a second? Mr. Havey? Thank you. All those in favor?
Aye.
Mr. Barnes, we'll take your I now. Thank you. We are adjourned.
I know.